Thanks for staying with us. Now, it will be many years before we solve all the reasons behind the complexity of cancer, and we may never be able to reverse the lives of those affected by cancer. We can, however, work to identify cancer as early as possible and assist in empowering individuals and families to get an early diagnosis followed by intervention. Now, as per statistics by multiple cancer research organizations, early detection and treatment often lower the odds of the complications related to advanced cancers. Thus, we believe that only by opening a dialogue on the subject will people be more aware of the early warning signs. Now, cancer prevention is a practice of taking active measures to lower the chance of getting cancer. Now, according to a report by World Health Organization, between 30 to 50% of all cancer cases are preventable. So early detection of cancerous or precancerous growth will not only save lives, but also reduce the financial and emotional stress of the treatment. So how aware are you? Please let us hear what you have to say. Remember, you can join the conversation. Send us an SMS or WhatsApp to 081-803-84663. So Elsie, I'm going to bring in our guests in a minute. I just want to understand, have you ever done any form of cancer screening in the course of your life? Okay. Well, that's why we're having the conversation.
Why is the cameraman laughing?
Well, that's why we're having the conversation.
Yeah.
Yeah. So I have done breast screening.
Okay.
I don't think I have done, so when you're pregnant, they just normally check for things like maybe ovarian cyst and all of that.
Okay.
But I have done breast screening, several times. The only one I haven't done, which I'm going to beat myself, is cervical cancer.
Okay.
Because I hear that as soon as you're sexually active, you are supposed to do that. Before it used to be tied to ages, but now young girls are having sex, so you have to take care of that because that's one cancer that is very deadly.
It is.
And it's highly preventable.
Yeah.
Yeah.
So cancer is one disease that I hate that it exists, right? It is, the fight against cancer is just terrible, which was why you mentioned earlier when you're talking about we have other serious things that putting COVID-19 at the front burner just doesn't make sense to some people, but of course we know where that is coming from as well. So I'm glad that we're having this conversation. For me, I probably have that fear that a lot of people have in terms of what you know. Now there are a lot of people like me will tell you, when you go to see a doctor, they must see something, right? So it's better I just stay and not do anything. But looking at it from now informed point of view, you understand that it is better for you to do these checkups and know what you're dealing with. That way you have a better chance at fighting it and living a healthy and longer life, right?
Absolutely.
So let's have the conversation.
Yeah. And again, I think for people that probably have history, like if you remember Angelina Jolie, she had to take off, she did a full vasectomy, what do they call it? Remove all the breast, So she did that because there's a history of cancer in her family. So sometimes, again, maybe you've not had any close person, maybe that's why you're not pushing.
No, I haven't.
So that might be another factor.
But this time around, I'm sure our guests will change
you change your disposition.
View. Yeah.
All right, so Dr. Femi Olaleye is a clinical entrepreneur, a health project manager, and a prudent business administrator. He is a solution-minded and vision-driven change agent. His foundation designs and delivers free and affordable cancer screening services for men and women across Nigeria. He is also passionate about improving clinical governance in healthcare and the reduction of costly medical errors in Nigeria through clinical risk management. And he's joined in live in studio with us. He has many accolades, but we couldn't want to shutting it down. But thank you so much, Dr. Femi, for coming.
Thank you. Thank you, Elsie. Thank you for having me.
This conversation is something that, it's almost like people think it's a broken record when you're talking cancer awareness. But every now and again, you see people die. I remember I got a call. I can't forget the date because it was my nephew's birthday from my sister. She calls me up around maybe 2 p.m. Please, do you know any doctor in Luth? what happened? And I said, okay, I didn't even ask what had happened. I called a few people. So the next thing, the doctor that I eventually got said, what is the case? What's the condition? And I called my sister back and I said, what's the issue with the person? Oh, the person was diagnosed with breast cancer. She refused to allow them to probably cut off the breast and all of that. She's already on oxygen and all of that. As soon as she dropped the call, because my boys were me in the car, I said, I don't think that lady will make it because she was already on oxygen. Breast cancer remains one of the cancers that if it's detected early, I mean, it's like a walk in the park. It can just easily just be treated and all of that. Why do we still have a lot of people dying from breast cancer? Then we can now move to the other kinds of cancer.
It's simply ignorance.
Wow.
It's the biggest factor here. And that's why on a day like this, kudos to you and your TV station. We're dealing with this demon. And it's a twin demon of ignorance and poverty. Poverty of mind, poverty of funds, and poverty of knowledge. But let's tackle ignorance. For example, just last week, today's Tuesday?
Today is Wednesday.
Wednesday. So I got results yesterday. So I operated on a young girl, 36-year-old, last week, Wednesday. A sister at the age of 36 died from breast cancer. Now, she's 36. She came to my clinic and I said, go do a mammogram. Mammogram showed a tiny nodule. And I said, I'm going to take this nodule out right now. You're not going home. And fortunately, she could afford our subsidized rate. I operated her. I got the results yesterday. She and her husband came to see me. It's breast cancer. But because it was like this, we've managed to save her life. Because she detected it early. She had knowledge of the risk she had with
the family history.
She could afford it. And thankfully, my foundation was there and I'm physically available to deliver that care. So she would not die from breast cancer. But multiply that with how many other women we are yet to reach. How many women do not have access to that information? How many women still die from breast cancer? And again, it's important to also stress, it shouldn't cost a lot of money. Prevention is cheaper, not only better than cure. And that's why all women must be taught how to examine their breast. Don't allow that guy to be the only one touching your breast, for God's sake. You know?
So I do that in the bathroom where you're supposed to raise your hand.
Precisely.
Then do three
what
fingers
you should do is
and
called
massage.
self-breast examination.
Yes.
And I'll quickly teach your viewers, and of course some of you who are already aware of how to do it, learn to do it properly. So 3 steps. 1, you raise your hand. You use these 4 fingers to examine the opposite breast. So in this instance, the left breast.
Okay.
You assume your breast to be like the size of a clock. So this is 12 o'clock, 3 o'clock, 6 o'clock, and 9 o'clock. So girls, let's do it.
12 o'clock.
Right hand on your left breast. Right hand on your left breast. Let's start with that. So 12 o'clock is up here. And if you press down there through your nicely well-packaged dressing, we'll see that it's soft, right?
Yeah.
It's bouncy and soft.
Yeah.
So if there's a lump there, one of these fingers will pick it up. So lift those fingers up and come to the 3 o'clock of your breast, which is by the side. Press it all the way down. Again, it's soft and nice, right? And then you do the same thing at 6 o'clock. And you finish it at 9 o'clock. It doesn't have to be in the bathroom. You could be sitting there as you're watching this TV right now, women. Have a go.
Please check.
Tuck those fingers underneath your bra, underneath your T-shirt, whatever it is you're wearing, and feel those breasts. That could just be the first thing you would notice about, oh, wait a minute, I've never felt that before. And don't panic. 80% of the time, lumps in a woman's breast do not necessarily mean it's cancerous. 80% of the time when I remove breast from women, lumps from women's breast, they are not cancerous, they are benign, fibroadenoma. Fibroids in the womb can grow in the breast as well. We call them fibroadenomas. But the 20%, I'm really keen to know what that is all about. So once you've examined the right, you examine the left as well. And then you take those fingers towards your armpit and then you press the nipples to be sure you don't have any discharges. If there are discharges, colorless, milky, that's normal. But it starts turning to green, brown, red, then you want to come see a doctor. And then, of course, I'll reassure you as much as I can that it may not be anything, but I want to keep an eye on those breasts. And if you're over 35, then save money and do a mammogram. A mammogram is an X-ray of the breast, which simply means hey, don't trust those fingers. Let a machine do it. And they always do a better job. So an
Doctor, I hear
X-ray,
mammograms are really painful. So
They're
because
not.
I have gotten to the age where I'm supposed to do a mammogram.
you should go do one. They're not painful. It's basically some flat plates pressing against your
Do you
boobs.
understand?
Person.
Against your, no, not just spam, just gently pressing and then taking a picture, because the X-ray film, it's underneath your breast. So the X-radiation would do that. So take a picture, fraction of a second, and that's it. And once you've done that, the digital film will be printed on the computer, and the radiologist can look at it, and then you've given the all clear for at least a year or two, and then you can come back and repeat it again. If you're younger than 35, then we can do ultrasound scan, and that is not painful. That's like the scan you use for pregnant women, and that should be done quite often. Particularly, you have these 3 risk factors. 1,
Family history.
family history. You're a black woman, you have not had a child, and you're over 35.
Okay.
So a lot of women out there are already high risk. Because
Why
we
black
not
women?
have black women, we find out a lot of black women in their late 30s and 40s who have delayed procreation are exposed to estrogen and progesterone a lot more. And therefore the cancer risk of the breast is increasing. That's what we know now. That's why we have lowered the age of mammogram from 40 in Caucasians to 35 to African women. All right? And then more importantly as well, ladies, please take this very seriously.
So
Do this every month
was
after
gonna
your
ask,
cycle,
yes.
after your monthly cycle. You know, once you've gotten your period out of the way, your boobs are no longer tender, make sure you get to touch them, whether you are lying down, whether you are sitting up in your bed, whenever you remember, just take it. You know, a lot of you have this ovulation app thing that you use to keep track of your ovulation. Just put a little note there. I should check my breast as well.
But doctor,
and then twice a year.
sorry, Elsie, you
once
come
a
in.
while,
I was going to
come
say
see
that
me.
if you check your breast, because they've done something like that similar. I checked my breast just right after I finished my monthly circle, and they said it's also normal sometimes if you are on your period for you to develop probably some kinds of lump or something.
I think that's what he said
true?
immediately after the period.
No,
yeah?
because so after the period too, it might still be there.
No. If it's pathological,
Yeah.
that means it's a disease.
Yeah.
Whether you're having a period or not, it will be there.
Okay.
But the reason why we avoid that is because during your period or when you're ovulating, there are a lot of hormones flying around,
Yeah.
and your breast gets a bit
It
excited.
gets heavy and painful.
I use the word excited so that it's not a disease. So they get excited, and you're like, oh,
My breasts
please
have
don't-
been excited lately.
Why is it
I think it's age.
so we want to remove the effect of the hormones
Yeah.
so that we can get to the real reason why you're having some discomfort. The biggest symptom the women get when they come to see me is breast pain. I've got news for you ladies. Breast cancer usually painless. So when you have pains in your breast, yes, it's good. It pushes you out of your comfort zone to come see me.
Yeah.
Look at Elsie saying, I've never gone for screening. The day she start having painful breast, she'll be like, Dr. Femi, please.
I mean, not have pain.
She'll be like, yes, it's been paining me, so I want to come and see you. And I do get a lot of those women come see me.
So in this fight against cancer, I'm calling it a fight because this cancer,
is.
if I can see it,
You choke it.
you know, I think there is a huge role for statistics and data, right? And that is one of the areas we are lacking in this part of the world. But you've been in this space for a very long time. Do you think we will get to that point where we can have enough data to...
The data is being collected for us, Elsie.
Okay.
I mean, there's a global cancer data, global can, which is global cancer study done to figure out the incidence and the mortality associated with cancer of women all over the world. So they did one in 2008, and every 10 years they do this. They did another one in 2018. So we have, in the past decade I've been doing this, I have 2 comparative data. In other parts of the world, that they've been doing screening and they've invested in the lives of their women. Because for God's sake, women form the bedrock of society. If you invest in your women and you protect them, you protect their rights, their human rights, their welfare, and their health, then you are a developed country. The reason why we're still developing is because, hey, ladies, we're still developing our rights forward towards protecting your health. And that is not good enough. So in those countries that they have protected their women and they are screening them, all this screening thing we're talking about, if you're in England, you would have been written a letter by your GP by now, and it's free.
It's free.
All right? So because we're not doing that, or have you received a letter from a GP in the last?
Who is the GP?
We shouldn't be talking about that. But on a more serious note, because we don't do that, statistically, a woman would die from breast cancer 1 in 25.
Wow.
So if you gather 25 women in a church, 100 women, 4. So you can do the sums of how many women are here. And the same thing with cervical cancer, which is even more painful to me as somebody in this field. Cervical cancer is actually one of the only cancers you can prevent. See, breast cancer, early detection is the best protection. Just like these 36-year-olds I just told you a story. But for cervical cancer, you can actually prevent it because the cancer of the cervix exists precancerously for 5 to 10 years before actually the cancer. Waiting for you to bring yourself
to the hospital
for screening,
for
an examination, so that we can detect it. And we know what causes it.
Which is?
You're looking at me.
Sexually active.
Yeah, we guys. We are the ones that infect you women with this virus.
So I hear that when men are philanderers,
Break it down. What does that mean?
It's
They are
pure, pure.
It's a philanthropy man.
They are philanthropists, right?
Wow.
Yes, they are generous. They are generous with their organ.
I think I'm the one lost on this table.
When a man is generous with his organs, right? His genital organ, and he's all over the
How are you
place.
painting this thing? When a man is promiscuous, which one
I
is
hear
generous?
that.
It's a big grammar.
Yeah, I hear that.
So when a man is all over the place,
He's all over the place. So I hear that
sexually,
the chances of his partner, that's his wife or a partner, getting cervical cancer is really, really high. She's at high risk. Is that true?
okay, I would say yes, but let's break it down so ladies can understand this better, and people don't start slapping their boyfriends and their husbands at home right now. But hey, come and hear this one. This is what the doctor said. Men carry the virus on our skin, and you know our genitals are extension of our skins, and we picked up this, this virus from childhood, from adolescence, through when we become sexually active from our previous sexual partners, and the virus stays on our body as normal flora. So you go on to become a bit, adventurous. So you have maybe 3, 4, 5 girlfriends,
partners.
not necessarily at the same time, monogamously, consecutively. So Lady A, Lady B, Lady C, and Lady D, when you were with them, you were faithful. But you actually acquire the viruses from them, because these viruses, there are many strains. We label them 1 to 50 something, with about 13 being oncogenic, the ones that can cause cervical cancer. 2 can cause genital warts, HPV 6 and 11. So imagine this multitude of HPVs on a man's body. And you're now looking at me shaking your head. Not necessarily me, but in a man's body, a man wears a condom on his genital, and it doesn't prevent the woman. So all the viruses from his previous sexual encounter will be given as a gift to the woman.
Even with the condom.
Yes.
So men are walking viruses.
We are really carrying these viruses around. So, and you cannot go to a man and say, okay, thank you, you've done HIV tests, you have done your gonorrhea tests. Can I go and do an HPV test? No. We assume 99% of men carry this virus. But it doesn't do anything to us because our skins are impervious. It cannot penetrate. And we don't have a cervix. But when we penetrate women, your cervix is hidden away at the top of your vagina, safe from harm's way. And this guy comes along with his, I love you. And you ladies are suckers for I love you. And they go, oh, he loves me. And then he jams it, and then it releases his HPV. And it goes off. It breaks your heart. Then you have to move on to the next gentleman, who is now promising to heaven and earth is going to put a ring on it. And they go, oh, I've got my husband. And then he continues to give you a daily, nightly dose of HPV.
Yes.
It's like it's time for a break.
so we
Now
can't
you start this thing.
Daily, nightly dose. So when you are doing it 5 times a day, just be calculating on the viruses. You know what? Let's go for a break. We'll be right back. So if you just tuned in, we're having an amazing chat with Dr. Olaleye on cancer awareness and prevention. Remember, you can join the conversation, send us an SMS or WhatsApp to 081-803-84663. I mean, it's been an amazing chat. I mean, I can't believe daily dose. I'm still trying to wrap my head around it. Yeah.
Global public health problem. That's why in other parts of the world, they make it a fundamental part of primary health care.
Yeah.
They have dedicated funding. In England alone, there are 4 countries that make up United Kingdom. England, Scotland, Ireland, and Wales. They dedicate $1 billion, not naira,
For
pounds
testing.
all only for
screening. Yes. I know my friends that live in the UK. One of them, she works in pharmaceuticals. I mean, all of them, they send,
Yes.
you must go.
That's how important.
Yeah, that's how important.
it
So even if you
is.
don't care about your life, we care about
They
you.
do.
You have to go.
And that is the real reason. Because they recognize that if they can do that, they can invest in doing that. The women can live longer.
Yeah.
They can pass on generational wealth. They can raise children. They can do a lot more because women, really, like I keep saying, in any decent society, they form the bedrock. And on a more serious note, because I like bringing in the humor to sort of capture the essence of what this is all about, we now need to take this fight to our women. They need to know this is really important to them.
Yeah,
So, you know
I
what?
was going to ask how the awareness is. How
Precisely. So,
we
so
are-
faith-based organizations should be organizing this as part of their female conferences. No, it's enough to be wearing Ankara and be doing Jesus is the Lord. Organize screening for your women. When you're doing your harvest, whatever it is you're doing, a lot of women in churches right now really waiting to have this test done for them. Organize an outreach screening for them. Corporate organizations should do the same thing. Good thing that you're doing this. A lot of organizations want to do CSR. Use this as an opportunity to partner with our foundation. That's ways of giving back to society.
Yeah.
There are a lot of people you have access to who don't know this, and it doesn't cost a lot.
You know, Doctor, I said I was listening to the radio yesterday, and interestingly, they were talking about cancer. Something really alarming for me. They said that in another 10 years, by 2030, that Nigeria would have, I think, whether the second highest. So this is big.
And that's
Why?
because we are not
It is. We're not doing
testing.
enough.
So
We're
is
not
it
doing
is so now? Is it the testing, or did we change our diet? Because
No.
cancer is not so. It wasn't really synonymous to Nigerians. I mean, to Africans. You know what happened? What changed? And
there
now
are a
with
few
this kind of
reasons for that.
number, they say that by 2030, our numbers, I think, we're going to be like one of the highest in the world.
Yeah, about the way United Nations, so what the WHO put it that in 2025. This is the data. They're projecting data of the data 2018. Now, add another 25 years, 50% more deaths would be occurring
by
from
cancer.
cancer in Africa and developing world because we are not investing in anything to prevent it. And that's damning. For any healthcare policymaker out there, if you are really truly keen to say you care about the lives of Nigerian women, what's your budget for cancer screening? They don't have any. From across 36 states of Nigeria, there's none.
Will you partner with the Lagos State government? So what are they doing in
Okay,
Lagos
so it's
State?
left to a foundation like mine and a few others, all of us struggling in the field, to be going cap in hand, looking for where pockets of money exist. That's not sustainable.
There has to be a
It has to be
There must
deliberate.
policy, yes.
It has
That's
to be
where I'm
deliberate.
going. There should be a policy from the state assembly, lawmakers saying all our women, you must do screening. And there's the fund to go behind it. There are 774 local governments in Nigeria. Let's go logistics with this. 774 local government. Every local government has an apex nurse, a medical officer of health, and a health center. What stops us making sure all women in Nigeria file up through their health centers
and go
get
for screening?
You don't need big equipment to do this thing.
Wow.
You just need to check women's breast and check their
The
cervix.
pap smear.
In fact, the pap smear has even been made better and more sensitive and cheaper for countries like ours. So we use a method called visual inspection, which also uses a colposcopy, which was an innovation I brought with my foundation. So you can actually get to see your cervix on the TV screen. You can take a picture. You can share with your sexual partner. Say, okay, oh boy, come and see your HPV work. And I do get that kind of conversation with my patients. And again, it also great at making sure they respond to treatment. Because when you don't see, and you tell a woman something is going to kill you in 5 years' time, she go say, they come. But when she can see it,
and she sees the thing
the
growing,
problem, then a lot of them respond.
So
positively.
talking about affordability, I mean, we've established that we don't have government funds channeled towards this area. How affordable is this, and where are there places to get free screening?
Yes.
Subsidized screening?
And that's the only way.
You know,
we need to remove the barriers of access to our women.
Okay.
So when I first came 10 years ago, I was like convinced government should do this. But I didn't get anywhere with it. So I set up a foundation, the Optical Cancer Care Foundation. And I started partnering with faith-based organizations, the first being the big network of church called the Redeemed Church. And then, of course, that took off very well because the head of the Redeemed Church saw that as a very important aspect of work. Christian Social Reformation of Christian Church, CSR, and a lot of other churches started embracing that. Now we've gotten churches to be partners. Mosques, Muslim, faith-based organizations are now doing the same thing. So we go to their Friday prayers and they organize these women for us. Now we need to move from there to government. And that's where the problem is. Because until it's a government policy, we'll just be scratching the surface. And that, for me, is a frustration because we can do it. This country is blessed with a lot of smart, clever people. We can leverage IT to reach a lot of our women through SMS messages, but nobody wants to carry the cost of doing that.
But you know this thing you
So how affordable is it?
Yes.
It's still a 10,000, 15,000 naira test. In a country where the minimum wage is 18 to 20,000, you can imagine a lot of people can't afford that. So our foundation is coming in to do that as free as possible. So we got a support from Lagos State government to test run this across 6 local governments. Thank God for our governor, Babajide Sanwo-Olu, who approved that we should do this. We're screening only 1,000 women, which for me
across
is
the 6 local
six
governments?
locations,
Okay.
and we are using that as a test to see how effective. We'll look at the data rather than quoting data from abroad. We can say, okay, out of 1,000 women, how many were positive? And we're very grateful for the success we've had so far. We screened 5 locations already. We're completing the last 2 at Loma, which is an agency of Lagos State government. We're screening 200 women there next week. And then rounding up in Ebute Metta. We started at Eko, Lagos Island, Lekki, we did one at Lekki, we did one at Onigbongbo, and of course we at our Surulere office as well. So pulling those data together, we'll be able to use that to convince government that this is something that we need to do, so we can do 10,000, 100,000 as the year goes by. And of course, more women should take this very seriously. You don't have to have a lot of money to be able to do cancer screening.
I was going to come to that. So when eventually I come for the screening and you now find out the result is positive, because, you know, again, when you talked about faith-based organizations, we have a lot of faith-based organizations preaching, God forbid, it's not your portion, you pray and all of that.
Portion, yeah.
You know, only very few churches are actually saying, you know what, go and see, go and do the screening, go and, you know, a lot of churches just believe that anything that has to do with medical, and I think it has really affected us as a people. We do not take medical, because we just believe that every sickness, we just pray about it and God will heal us.
I totally agree
right?
with that.
So what are we doing, you know, to, first of all, get more buy-in of, because religious bodies, they play a role in shaping the mindset of people. Then again, when you eventually find out you're positive, you know, some will take the result and go to church and sit down in the altar and be praying to God. I mean, is it a death sentence, especially for cervical cancer? I mean, is it a death sentence? And again, for breast cancer, what's the process like?
Okay, I'm happy you brought up the issue of faith-based organization. I've been a child of God. I read the Bible. I know His desire for me is to prosper, be good at, even as my soul prospereth. But however, you know, further on that scripture is 3 John 2. 3 John 4 says that nothing delights me more than to hear my children walk in truth. Now, the truth is that if you don't check yourself, you will die from something you shouldn't have died from. Because faith without works is dead. So if you have now checked, which you have saying, oh, this thing is going to kill you, and you now sit on an altar, you are being stupid. Yes. You need to seek medical attention. And medical attention, medical knowledge is actually an inspiration given to us by God himself. So the advances we have in medical technology is from God, because God has given us all knowledge over all things. So we thank God for that. So I like to speak to my Christian brethren or any faith-based organization out there that if you've been given a diagnosis, don't just do I reject. Do what you need to do afterwards. Follow it up with your medical attention. Now, how affordable it is.
Yeah.
A good lot of organizations support church members, and it's one of those social or welfare support systems I see
Happening.
churches and faith-based organizations very, very good at doing. So if a sister is having an illness, I've seen a lot of church members contributing for a surgery. The challenge we've always had, and that is key, when I see a woman who we have screened and she needs treatment, usually we don't get enough support to get those women treated.
Yeah.
So I screen 100 women in a church, 10 will be positive. 10% positive rate is what we have identified in Nigeria. So if I screen 10 ladies in this organization, I'll find one. If I go to a Unilag and I screen 100 undergrads, I'll find 10. Could be more. If I go to a church and there are a lot of widows there, and it might be 5%. But across the population, usually 10%. So out of those 10 that will turn that we identify as positive, maybe about 2 or 3 will come for the early treatment as necessary. The rest will not show up because of money.
So how do we solve that? Because knowing that you have this issue and then you cannot treat yourself, I think it's
not even
it's
worse.
an added
No
problem to your mental
and that's
health.
where we keep talking about this. Government is the only organization that can do this. So if you go to a health center and you've been screened and it's positive, then of course the intervention will be in a general teaching hospital, where the cost of care is affordable, not as bad as if you had come to a private organization. So again, we can't let our policymakers get off lightly. Anytime I see them and I engage them, I say, you are doing well, but you are not doing enough for our women. Particularly, I'm very keen about our women, and I see myself as an advocate of that. Okay? And for women out there, in the meantime, if you can't get our policymakers to make this a policy, find a foundation near you. If you're in Lagos, obviously we are in Lagos, but we are not in Lagos. A few other organizations outside Lagos, like in Abuja, Kaduna, Enugu. I have partners. I don't want to mention their names. Just Google them. You should be able to find those foundations.
Cancer support foundations.
Foundations.
Okay, so someone is asking, you didn't drop your name. Hello, please, we tuned in late. Will there be a recap? Of course, there will be a repeat at at 12:30 p.m. tomorrow. You can also watch it on GoTV at 8 p.m. tomorrow as well. Channel 112 on GoTV. So you can always catch up, you know.
Let me take this message.
Yeah, go ahead quickly.
So, highways. Okay, so this person is not talking cancer. It says, Elsie, on the government official who married a 16-year-old, relate it to NCC saying only 18 years plus can get SIM card, and no, we are ruled by clowns. They can marry underage girls, but underage people cannot get SIM card. Laugh out loud. I had a random message here, but it's really long. The person is basically sharing his experience. I said I had a thyroid surgery on the 7th February of 2019, and stresses on malignancy were found. I was advised to take iodine therapy. Iodine. 6 weeks after the surgery, I went to National Hospital Abuja and was told that they have not done it in 2 years. They referred me to UCH Ibadan. I went to Ibadan, paid for the iodine, and was told to come back in June 2019 because they had to import the capsules from abroad. Up to July, they were still telling me stories. I went to Ghana in July, paid for the substance, and had my therapy in 2019, 6 months after the surgery instead of 6 weeks. Ibadan just called me a few months ago in 2021, after 2 years, to come for the capsule.
Whoa.
Imagine how many people would have died even after early direction.
Hundreds of thousands.
Early detection. Government needs to help with the medication, please.
Exactly. So we can't let them off lightly. I mean, we are in the doldrums. It's one of the reasons why I've become a social entrepreneur of some sort, because I don't want to get frustrated, cap in hand, begging for money. So I had to look for a sustainable way to deliver the service, while at the same time, I keep bringing the discussion to the front burners. You know, delivering the care, because if I was just going around TV stations talking about government, somebody would probably tell me, go and sit down. But I've been delivering consistently And you know that. And I'm so do you. I've been following you all over your media career, actually. You know, and women too know this, because now the biggest source of referrals to my clinic are word of mouth from other women who have come to our clinic. But we can replicate this service before I get too tired, before I get too weary, before I get fed up, before I decide I don't even want to be here anymore. I need a plan B, like some of our people are doing, and get out of here. Before we get to that point, can we not all come together and say, how can we save the lives of our women? I love the way you have said your title, a preventive approach to lowering death rate. People are dying.
True.
A woman dies every hour from cervical cancer. That's 24 women have died today. Just because somebody said, I love you. How tragic is that? And I've just clearly identified how we can prevent it. And it's not going to cost $1 million. Some few people just got locked up for a few weeks, and somebody called black money or white money, whatever, just won 90 million. I'm going to go there.
You know,
A woman, do you know how many women I can save with that kind of money? We can lower a lot of women dying from this kind of. Let's talk about this. That's what the aim of this show is all about.
I
Sorry,
think so.
But
I'm happy you said that.
There are a lot of sponsors that can do this. There are a lot of
that.
people who can do more for our women.
Sadly,
but we do this.
But I know we're
Sadly,
running out
it's
of
not.
time,
Yeah,
right?
it's not. So it's not. There's no ROI. They'll tell you there's no ROI. You know.
Return on
lives.
investment.
Yes, they'll tell you.
saving
No,
lives.
it's not their business. What's the
saving
ROI?
lives.
Okay. You are
Quickly,
here
we ran
with
out of
us,
time.
right?
Yes.
And we would like to know, I mean, those watching ways that want to
Yes,
know,
we are doing a giveaway.
what
We've been
are
talking, we
you-
want to give a
Let
giveaway.
it come from him. What are you giving?
Yes,
to
I
them?
am doing a lot for women. I'd like you to be part of that. And I know you're doing a lot of stuff for women. You're women yourself. So starting with members of your organization that are female, all of you are going to get free screening anyway.
Oh, thank
when
you.
come. And all our viewers who have watched this show, or just turn up on this October. Because October is month of breast cancer awareness. I can see I'm decked out in pink.
Okay.
And I think my lovely hostess is here
have
too.
pink on my
They have
lips.
pink lipstick. So they've convinced me that's pink enough.
Yes. Yeah. So
Just turn up with a touch of pink. This October, you get a discount on your mammograms, you get a discount on your scans, you get a discount on your vaccines. And if you turn up on a Friday, you pay 50% on the cost of screening for women. That's usually available Mondays to Saturdays. I don't want to mention the cost and prices.
Awesome. So we'll
and you
probably-
can follow us on
Yes, go
Instagram,
ahead, yes.
Optimal Cancer Foundation. You can follow me, Dr. Femi, and you can ask for more information concerning this. And more importantly, just find us. We are
Because-
118 Body Thomas.
Absolutely,
in Surrey.
Yeah,
because
so when
for
you
me-
get there, just mention ways. right?
mention ways,
Yeah.
because for me, I think, you know, again, now that we have younger girls getting sexually active, it's even a lot more horrifying for me to just try to imagine
Yes,
how many
19-year-olds are having cervical cancers now.
Yes,
Wow.
19-year-olds.
Yes, I've seen
And
a
this
few in
was
my clinic.
something that did not used to happen.
Yes, because they've been having sex
Yes,
since
because
11,
they've been
12.
having sex since 11, 12. So it's actually a big deal. And if we understand this, women, you are the one at risk. The man is not at risk, especially for cervical cancer. So please do not joke with it.
Yeah, we didn't
If you are
have time to
sexually
touch on
active, yes.
prostate cancer
That one is
as
for
well,
men. Don't worry,
but-
they'll be all right.
Ah,
They'll
Invite,
go and see
invite
doctor.
me back.
Really?
Invite me
We'll
back.
bring you back, yes.
Talk
We have
about
to
it with
because-
another man.
With another man.
Yeah.
Yeah, because I saw the data, and most men actually die from
Yes.
prostate
But you
cancer.
see, this
Yeah.
cervical cancer and breast cancer, please, it's
And there's a
preventable.
vaccine for it. as
Yes.
well. So parents should give their daughters
Absolutely.
the vaccine against
So we've
HIV.
run out of time. So
That's
quickly,
another
doctor.
conversation.
Yes.
And you get vaccination discounts as well.
Oh,
Because you have
fantastic.
not been vaccinated.
No, I don't think I have
And you're
before.
getting nightly doses.
Hell, Jesus, don't be saying that.
Yeah.
Let's do the because we want to run off quickly, like in a
We are
minute.
not there. I'm
You're not
saying
there. Okay.
Are you celibate? Are you
Don't be
celibate?
there. No, she's not there.
Please, doctor,
When
again.
someone
So
says, "I love you,"
four
she goes,
fingers. We go from
Okay, yeah, go
Here.
ahead. 12 o'clock,
12 o'clock,
3 o'clock,
3 o'clock,
6 o'clock,
6 o'clock,
9 o'clock.
9
Basically,
o'clock.
you're going clockwise.
You're going clockwise. So you
only.
take it round
like
your
that.
breast.
If your breast is
Feel
quite
it.
small,
Yes.
then you do it once. If you're quite large, then you do it like twice.
Twice.
Moving closer to the
Yeah, because some people are
nipple.
extremely busted. They're the
Yeah,
size
so,
of one
so
breast
don't
is like the size of my
panic.
head.
So don't panic. Start from the outer part of it
your breast.
and then go
Inward,
inwards
okay.
towards. And then if you get comfortable doing that regularly, the day a tiny
You will
seed-like thing starts growing,
You will
then
feel
you
it.
know because that's stage 1. But from seed, it becomes like size of tom-tom. That's stage 2.
Wow.
From that, it goes to agbalumo or cherry or garden egg. That's stage 3. By the time you are actually feeling a bigger lump in the
It's
breast
gone.
of a woman, it's
That's
already
too late.
Again, like you said, not all lumps are cancerous.
Yeah, so
don't
just
be
go and
scared.
get checked. Don't be
Go and get
scared.
checked.
Thank
Yeah.
you so much, Dr. Femi. I think we are going to come
Thanks
to
for having me.
we're going to come to your clinic. We will go and get ourselves screened.
Yes,
all the ladies,
and
all 10 of us.
vaccinated
And
from viruses
we have
that are
female
walking
nurses,
around.
female
So
doctors.
if you are concerned about a doctor looking at your, there are
Yeah, it's all
females that will
female,
check.
yeah.
All right, thank you so much, Dr.
Thank
Femi.
you for
Thank you,
having
Elsie
me.
Godwin, for doing this with us. All right, so before we go, do ensure you follow us on Instagram. It's at PlusTvAfrica. You can drop a comment. And more importantly, we just gave you a giveaway now. Take advantage of it. Go
Yes,
to the
please.
clinic and get discounts. But what is more important
What's the
is
address
get
again?
yourself screened. It's in Surulere, right?
Bode Thomas, 118
Bode Thomas. Go there and get
Cancer
yourself
Foundation.
screened, please. We cannot have more women dying because of preventable
Disease.
cancer.
Yeah.
All right, so like, share, follow us now. It's at PlusTvAfrica. We'll still drop the details on our page as well. All right, so if you missed today's quote, here it is again. You beat cancer by how you live, why you live, and in the manner in which you live. So it's lifestyle. Let us together join hands to beat cancer. All right, we'll see you tomorrow at 8 p.m. as we bring another great conversation to your screen. Enjoy.